Sexual side effects.
Did you write this?
Sexual side effects are common with antidepressants in both men and women, so your concern is understandable. Effects on your sexual functions can include a charge in your desire for sex, erectile problems, orgasm problems, problems with arousal, comfort, and satisfaction. First, what to expect before the main presentation. So yes, I captured your attention by sexual side effects because I know a lot of people taking SSRIs, tricyclics, MAOIs, suffer from erectile dysfunction, and women suffer from it just as badly. But first, what to expect before the main presentation. I want to say these slides have been provided from Mr. H.
Some like this back.
Mr. H. I've got a new person in my house who's going to be presenting his story on tape. But let me tell you a little bit about what I do. I'm sent these slides, and I review them very briefly, and then I go off what is said. I study all day long, 18 hours a day. I work on issues that involve these type of topics. So what you're witnessing is expert advice from an expert. I would not give you anything but that. And I want you to realize that I have your best expectations in hand. There is a brief outline that I'm given with the PowerPoint presentations, but I rarely review it, which is why I kind of stutter through the presentations. But you know, I work all day on topics. I have more than plenty of PowerPoint presentations to present, and I work all day, and so I really don't have time to find a recording system that works. I apologize for that. Let's continue with the presentation. Wellbutrin. Selective serotonin reuptake inhibitors, SSRIs, which includes citriptyline, Celexa, Lexapro, Prozac, Paxil, Zoloft. These selective serotonin reuptake inhibitors cause problems with sexual drive. Now, for example, Paxil. If you take it for a few weeks, you will eventually begin to feel alleviated symptoms. Now, so to say that all SSRIs cause problems is inaccurate. SSRIs do cause problems, but the fact of the matter is that usually people get over it with time. People gain tolerance to it. Adding a medication to improve sexual function, such as Viagra, Tadalafil, Cialis, or Verdanafil. Although these medications are used to treat sexual problems in men, initial research suggests Tadalafil may also improve sexual problems caused by antidepressants in some women. So we want to focus on both men and women here for a change. Men and women both deserve equal treatment here. So the drug that I would recommend to you most often is Cialis, because it does not raise your heart rate, it does not raise your blood pressure, and it is relatively stable. It's also been studied for a long time. Now, there are other medications that you can look into. Viagra is one of the first medications introduced. It is not the best medication, I'll be honest with you. It works for some people very well, but Cialis, I'm telling you, is one of the top of the lines. These medications are all head of the line. They work some better with others, but you got to explore them from yourself. Now, what's important is that both people get satisfaction. The report rate in the United States is about 1 case of liver failure resulting in death of transplant per 2,500, 300,000 patients year of use. Wellbutrin languished both on pharmacy shelves and as a focus on research, but in mid-1990s, low libido became recognized as a problem, and researchers showed renewed interest in Krenischer's earlier report. Several more studies showed that Wellbutrin caused fewer sexual side effects than SSRIs, and the SSRIs users who also took some Wellbutrin reported fewer sexual side effects and better sexual function. Fact of the matter, all of these drugs are going to cause sexual side effects. I would recommend Wellbutrin as a first step. It induces norepinephrine and serotonin and restricts dopamine, I believe. I hope I'm right on that. I'm looking at a friend of mine who's a med student to see if I'm right, but I'm pretty sure I am right. It relinquishes 2 of the chemicals and builds up the other. It's a very effective antidepressant. It is not ordinarily used as the first one to treat, but it can be very effective at both antidepressants and less sexual functions. And in addition to that, it has a stimulant effect. The stimulant effect is very positive, and that's why many doctors use it, because people with brief ADHD problems will be prescribed Wellbutrin. It doesn't last very long in the system compared to the antidepressant effect, but it is considered distinguished and well sought after as a mild drug to treat ADHD. Okay, now I talked about Wellbutrin. The other drug, the reported rate in the United States is about 1 liver failure transplant, 2,500 to 300,000. That is another drug that is good at treating sexual side effects, but the problem with it is it's not used very often because it has it causes liver damage. That's how I'm going to put it to you in short. I read all the literature on it, and the fact of the matter is, you do not want to be one of the statistics that get liver damage. You just don't want to be. Because of this, it's not as prescribed as often. It is still prescribed. The chance of you getting liver damage is very rare, but much more heightened than any other antidepressant. Be careful out there. Abide by your senses. Sexual side effects can be much frustrating, but there are ways to get around them. I will go into detail on further notice. Good day, good night, good mental health.